All right, thanks guys for joining this week. Have you guys ever walked into your clinic, looked at the waiting room, it's full of patients, and thought there has to be a smarter way to do this? Well, today I am so excited to introduce to you the CEO of Preface Health, a company bringing AI into the exam room and really just transforming urgent care, primary practices. Basically, if you're a physician in the healthcare space and looking to revolutionize how you manage the patient journey and the workflow in your office, this is the company you guys need to be checking out. So with that, thank you so much for joining. I'd love to hear just your background.
Thank you so much, Heather. It's great to be on. Yeah, so my name is Geoffrey. I actually, going back to college, I went to USC, the University of Southern California, for 4 years as a pre-medical student. So I really, really wanted to be a doctor. I wasn't too sure which at the time yet, but what ended up happening was I went through the whole 9 yards. I took the MCAT, I did research with clinicians, I did research in the lab, I published papers, and I was ready to apply to medical school. I was in the final stages of that, and I was shadowing actually an urgent care provider. And I had been formerly trained on EMT, meaning so I was riding along in ambulances, and there you're told, hey, when you arrive at the ER, you're supposed to give a 3 to 5 sentence just summary of what's going on with the patient that you're presenting to the ER doc before you hand them off. And when I was shadowing this urgent care doctor, I was wondering how come there is no such handoff when your urgent care provider is able to see a patient that they don't know what's actually going on with that patient. So that's basically what started off Preface Health. But that eventually translated into what we are now, which is the full spectrum of care, both in the clinic as a clinical tool and also post visit with engaging patients and making sure that they can navigate healthcare and reach the next steps of care.
I love it. You had this intent. You're like, I'm passionate about healthcare, but I have this other way that I'm going to, serve patients and physicians and practices, really, which I think is so needed because we're at that breaking point where we're seeing our physicians. There have so much admin work. They have so much time that they're taken away from actually seeing the patient and managing a patient and actually having to deal with all of the administrative paperwork. And so, why don't you walk me through like the software, the solutions that you have kind of, from start to finish? Like, talk to me about the software solution on the front end piece. What are you hoping to insert yourself into and are already doing successfully with many practices that helps them kind of decrease that administrative burden?
Yeah, so for this is more urgent care specific. So we started off as a pre-screen, and what this looks like is every patient is used to walk into a practice and filling out a static form that asks them a bunch of symptom questions that may not necessarily be relevant to them. We changed that by asking fully dynamic questions that are related to their visit. And for the providers out there, we pre-collect the HPI of patients dynamically in the same style and manner that you would ask a patient in the exam room. And we turn that into what's called a pre-chart. So providers are able to see in a dashboard what's going on with the patients who are still in a waiting room to give them better context of, okay, who might this patient be? What might be ruled in, ruled out? What test should my MAs administer preemptively before I walk into the room? And then that really just helps streamline the appointment, and you could come in understanding the patient far better than you currently would, where you would get maybe a 2 to 3 word summary of what's going on with the patient. Now you get a full comprehensive pre-chart. And what's more generally applicable to both urgent cares, primary cares, and some specialists right now is our AI ambient scribe. And what that does is it turns your pre-chart into a confirmative note. So how that works is you walk in, you record a visit, you press start before you walk into the patient room. You tell the patient, hey, I'm using an AI ambient scribe. This is going to help write my notes. And from there, you can maintain face-to-face contact with the patient and have your conversation, your interaction with the patient as normal. And we translate that when you leave the room into a completed chart in just a few seconds, really. And we're able to draw out the ICD-10 codes for urgent care specifically. What they find helpful is we draw out the proper ENM codes, and we provide good provider education on how to substantiate those coding levels as well. and what can be done maybe better that they didn't talk about in the visit, or that it wasn't included in the chart to help substantiate coding, which Heather, I'm sure you're very familiar with.
Mhm.
Um, so really, that's the clinical side of things, and more than happy to dig into the post visit side as well.
Okay, so um, really, it's really understanding the chart, what history you do have for them, providing that with a framework in front of the physician, and then capturing the visit and then pulling that information back. And I assume you're integrating with ECWs and all the nice EMRs that are out there to get it
Yes.
back into the chart. Awesome.
Yes, we have a
That's
long,
huge.
long list of integrations that we offer, and we have a dedicated team to make sure that happens.
That's awesome. I mean, that's a huge help. And I think what was really unique is this post visit side. I mean, both I think are very helpful, but to me, it's the whole suite of options that makes you guys stand out from your competitors. And I know this is a competitive space. Obviously, I personally like your approach. I like your background. I like where you guys are coming from. I know that our clients are interested in working with you guys. It was good to meet you actually in person too, which is really a cool this last 2 weeks. But talk to me a little bit about is the AI tool on the back end named Sarah? Did I get that right? Was it Sarah?
Yes, Sarah.
Okay, talk to me
Yeah,
about
yeah,
Sarah.
yeah. Of course. It was great seeing you in person as well with one of your really happy clients too. Um, so yeah, so Sarah is the name of what we call our patient health assistant. And what we noticed there is we looked at AI and we were like, what is it extremely powerful in doing, right? We knew it's not, or at least in the future, we don't think yet, it's not ready for medical decision making and actually making diagnoses. But
Yeah.
what it's really good at doing now is that it's almost past the Turing test. It sounds like a human, and it could scale. What AI allows you to do now is scale personalization almost at a concierge level to every single patient. So how we decided to apply that was through Sarah. And what Sarah does is after a doctor is done with their visit, they sign off on the chart. Sarah is able to see the medical record of the patient and reach out to the patient and make sure that the care plan that the provider spent time writing for the patient is actually followed by the patient. And right, this is extremely important for urgent cares where they see an extremely high volume of patients coming in and out of their clinic, but they can't personally follow up with each one to make sure that they're completing their full 10-day course of amoxicillin and taking it twice daily and not stopping on day 3 after they feel a little bit better, right? But what Sarah is able to do is make sure, hey, like make sure to complete your full 10 days. Here, I can set up some SMS medication reminders for you. And this is all via a chat interface with the patient. And then for primary cares as well, it's making sure that they maintain the correct dosages of medications that they're taking it along the cadence that they were prescribed. And all this information is already structured in the EHR note. But what we are able to do is we extract that and actually turn it. We make it patient friendly. We present their care plan in patient friendly language. We prevent a lot of patients having to go back or call the office to clarify their plan or figure out how to use a portal that they really never adopt. We actually present all this information to their face with Sarah as essentially a concierge level health assistant for every single patient that visits your clinic.
And I could see that applying literally across the board to any subspecialty because most practices are seeing high volume now. Most practices are giving a care plan where the patient is going to need to do something. Can you see, like, okay, patients where the care plan is just follow up in 6 months versus a care plan where they're given specific instructions for, say, the next couple of days or weeks or months? Like, can the AI tool look at the difference between that?
Yeah. So what's amazing about Sarah is that she basically is with the patient forever. And then every single new visit that they do at that location, Sarah gets updated. So it basically allows a continuous care assistant to be put in the patient's pocket, easily accessible via the web, via an SMS chat that we text them a secure link to. Um, it's extremely helpful no matter the cadence. And right, this translates, of course, financially in an urgent care is how do you in such a commoditized space where there's an urgent care at every corner around the street, how can you make sure a patient comes back to you? Sarah makes sure that if a patient ever feels worse, that they go back to your urgent care, never advertises another urgent care, makes it extremely easy for the patient to book back into your urgent care. And right, this translates into approximately 5 to 15% increase in revenue per month for a lot of the clinics that we work with. And for primary care, it's okay, now that you've realized a patient should go to X specialty, let's say an orthopedist, how can we educate this patient beyond the amount of time that you have in the exam room, which frankly is limited, right? Because you have a whole other panel of patients to see that day. How can you make sure that the patient stays updated and educated on why that orthopedist follow-up is important, right? Whether or not you're involved in value-based care, making sure that your patients actually reach the next step is critical for their health, and preventing just downstream higher costs for the patient if they don't actually make that follow-up happen.
And I do think just that extra touch, right? Like that extra touch with that patient coming from your office reminds them, hey, I've got this additional level of assistance that's there for you. And I know we're all still trying to get used to AI, although I did just see my husband sent me the robot Neo. Have you seen Neo, the robot that's
Yes, I
coming to
have.
homes? I mean, like wild. It like vacuums, it makes beds and hangs up clothes. It's crazy expensive, so not in our budget anytime soon, but it looks really cool. Anyway, back to Sarah. I do think those touches are really important to remind a patient just about the office, right? And so I know for myself, like I've got growing kids. We're not great about going to the pediatrician's office every year because my kids aren't, knock on wood, sick that often. And so, but that extra touch of, hey, did you know your vaccine is due for your 12-year-old? Or, hey, did you, maybe a kid had a sprained ankle. Did you get that checked out? And I don't know, just that level of follow up, I think just keeps patients coming back to the same office. Again, whether it's urgent care, primary care, or whatever, I still think that extra touch. I would be surprised if it didn't bring in additional volume or additional patients, because again, it's just that extra level of attention.
Exactly, and it's different from right, Sarah. I mean, I will admit Sarah can't do your laundry yet, but what Sarah can do is it. She does know that you were seen for X diagnosis and sent to Y specialist, so she can actually
Referral.
provide very personalized education on why specifically for like your let's say your fractured ankle you need to see an orthopedist. It's specific to your condition, and here's why it's truly important for you, not just generalized messages that say, hey, you have an orthopedist appointment coming up, which we do, but we
Yeah.
give studies. A lot of studies have shown that providing that extra layer of education significantly reduces attrition to the next step. Which, and any specialists on this listening to this would know that like you get plenty of referrals coming in, but how many of those actually translate into real patients walking in the door? And it's
Yeah.
not that many, unfortunately.
Yeah. Again, I think this next era of healthcare, again, we're all having to work smarter, not harder, because there's no more time left to give. I mean, the physician, our listeners are already at their max, right? They're seeing as many patients as they can see. They're doing all the administrative burden. They're running their practices. And so whatever we can do to layer on top, whether it's the front end of the practice, or excuse me, the front end of the visit, the back end of the visit, the middle of the visit, right? Doing the AI scribe. I mean, to me, that whole journey of a patient, it's almost like a patient navigator light. It's an individual, Sarah. So it's an AI individual who's helping kind of that whole patient journey. And then so is the physician, I assume the physician, there's like a dashboard or something they can go into, and can they see if they've interacted, or can the patients interact with Sarah?
Yeah, so physicians have the practice owners. We give them access to a dashboard that shows all the metrics that they have with Sarah. How many chats has Sarah had? How many pockets is Sarah in right now? And how many patients is she currently helping? We do sentiment analysis of like how happy are these patients that Sarah's interacted with? Were we able to solve their issue truly from their medical record? Or how many patients have we resurfaced your booking link to so they came back and you got an extra visit because they had a new ailment or they had a progression of their symptoms. All of this is visible, and we obviously give you access to the chats that Sarah is actually having with the patients, so physicians or any practice administrators can review it.
That's so cool. Now, can you also tell the patient, oh, where was I going with this? I totally forgot. I'll have to mark this. Where was I going? It'll come to me. I mean, that's just amazing. I really think this would be a huge benefit for practices. So talk to me a little bit about when you're meeting with practices, like what are they, are there challenges that they are facing, or are they big wins about the clients that you've already onboarded? You know, what are you hearing from your clients?
Yeah, of course. Clinical side, obviously, providers they're well too aware of the challenges of documentation. So that's obviously the quickest win that we often have, and our adoption has been really exciting there. Where we try not to even we don't force providers to use our platform. We give it to them as an option, but then after they use it 2 to 3 times, they're like, oh, well, now I don't have to spend 10 minutes sitting on my chart typing this up, or I don't have to come back home and work on this now. I can nearly close all my charts between patients. So those have been really quick wins, and now we're also offering things that they've never seen before, right? Like the pre-chart. Now you know exactly what's going on with the patient before you even see them. So the visit becomes far more streamlined, and at the very least, it becomes far more informed. And also on the coding front, for those who care a lot, of course, about revenue cycle management, like making sure that the codes are fully substantiated, right? We have a lot of stuff going on with insurance right now in the US, and the things that they've said that they'll do with coding levels and reimbursement. But how
Mm-hmm.
can, now that insurance is using AI to fight your claims, how can you use AI on your side to substantiate your claims, to make sure AI doesn't pull out your note or pull out your notes and then lower your coding level to a level that you don't deserve, and making sure that basically you get paid for the work that you did. Um, and also, it's unlocking, as I mentioned with the health assistant, it's unlocking unlimited personalization, truly scalable personalization, where Sarah is hyper personalized, localized only to each patient. So we spin up a new version of Sarah on our end for each and every patient. So there is no interaction between Sarah with patient John and Sarah with patient Bob, right? Those are two separate Sarahs that are interacting with that patient at a personal level. Basically unlocking that concierge level, and that's what technology is really great at doing, right? Scaling a lot of things that were not once able to be done uh, manually.
And are you seeing AI adoption in this kind of Sarah discussion increase? Right, I've heard in the past, like, oh, well, I'm afraid that my patients won't like interacting with an AI tool. I have my own opinion about this, but I would love to hear, like, you know, what are you seeing in the marketplace over the last 6 to 12 months? Are you seeing kind of this ramp up where patients are like, no, I'm opting in for that? Or are you still feeling like there's some hesitation there?
Yeah, I mean, obviously, patients are not required to talk to Sarah. Sarah's there to be helpful and only provide additional benefit. But a tailwind that we've been able to hop on that's been super exciting is that patients are a lot of times going to ChatGPT to ask medical questions.
Mhm.
But ChatGPT is not going to recommend your urgent care. It's not going to tell them to go back to your primary care. Um, and most of the time it does not have access to your patient's medical record, right? So
Yeah,
Sarah is
I
that
hope not.
new chat GBT that your patients can go to. Yeah, I hope not. I mean, who knows? But Sarah is HIPAA compliant. We don't share information between anybody. The information is completely siloed to the patient and the practice. Um, so now we're basically giving them a safe resource to go to, and we have proper escalation guardrails in place that ChatGPT may not necessarily have, or they'll try to ChatGPT or any other chatbot may try to help a bit too much in a way that may not be safe for a patient, if they're
Yeah.
asking it for advice as if it's a doctor. We are able to help them with their medical record. We know their care plans. We can surface that for them, But if they're truly not feeling better, we bring them back to you, the provider who can actually give them real care.
This is so cool. I mean, I think AI obviously is here to stay, right? This whole idea. Although I did hear, I think I shared with you, I love the podcast, Alex Hermosi and all of his stuff, but he did say something, I think it was him who said, as long as bots are controlled by humans, right, we shouldn't be afraid of like us all getting replaced, right? Because you're still going to need the humans to control the bots. And once the bots are controlling the bots, like we're all going to be kind of screwed. So, it's just like you might as well just lean into the AI and the technology because again, the idea here is the humans are still controlling the bots, and I do think there's this adoption. I mean, my friends are using different AI tools. I think patients are getting more comfortable with this. We're even seeing AI where you're calling and actually speaking to an AI a tool, and I think that's even getting more advanced. And so I think adopting these technologies, getting your patients used to them, getting your practice used to them, as the technology continues to improve, is only going to make us more efficient long term. Which, at the end of the day, what do our practices want? Right? They want better efficiency. They want better patient retention. They want, to make sure that their patients feel cared for in a way that they can't necessarily be doing all of this as with humans only. So I think Preface checks all of those boxes.
Yeah, I mean, we're really, I guess, some general idea around technology is that it's there to make your life easier. It was made to improve your lives, to provide benefit. So how I think it's smart to think how can it help you personally at a personal level. And at the end of the day, it's you're part of a business, right? So how can you also utilize that technology to best, I guess, right, increase profits, right? I know we're
Yeah,
caring for patients, but there is no, you wouldn't be able to care for them if you're losing money, right? Or
agree.
if you're not making as money as you should be, that you deserve. So how can it help at both the personal level, whether it's just personal chatbots or and all the way up to ambient scribing, and also at the organization level of how can we make sure that these patients are actually cared for and we get the proper reimbursements that you worked for, and basically all of these different levels AI can be applied, and I'm of the belief that you should definitely give it a try at the very least and see how it works.
Yeah. So if I remember correctly, there's a way for practices to kind of get in touch, do a demo, and try you guys out. Is that right?
Yeah, yeah. So our website is prefacehealth.com. It's spelled preface, Preface, health, .com. You can schedule a demo on our website there. You can reach us at hi@prefacehealth.com. I don't know if I'll mention my personal cell, but we have our business phone number on the website as well. But yeah, we're really easy to get in touch with. We typically, if you send us an email, we'll respond definitely the same day and generally within a few hours. Um, but yeah, and implementation is fairly quick on our end. It's less than a week, unlike most other solutions that may take a while. Some locations are as quick as a day. Um, we hop on a 20-30 minute call. If you need any customizations, we work with you on those. But really, we see ourselves as a partner with each and every location or clinic that we work with. And we try our best to basically satisfy all their needs with any technology that we can build for them and the technology that we already have.
I love it. I love it. Well, and for the listeners, we'll put those show links in the show notes, so that you guys can get in touch. Again, we have no affiliation with this company. We're just really, when we see a product or something in the marketplace that people are excited about. We have a client who's in the urgent care space who's excited about this. They're working towards trialing this out, and I believe in these types of technologies. I believe in young founders who are passionate and excited and knowledgeable. So I'm really excited for you guys. Let's just shout this from the treetops. So whatever we can do to help you and your team. For those listeners, if you are looking for a new revenue cycle management firm, please check us out at NatRevMD.com. We'd love to help you guys. We have been investing a lot in technology and AI ourselves, and excited to continue to partner and help practices who are out there trying to stay independent. So thank you, Geoffrey, for being on today and for sharing your story about Preface Health. It's been great to have you on, and I appreciate it.
Thanks for having me on, Heather. This was great.